Personality disorder is a chronic condition that is multisymptomatic and affects between 2 to 6 out of 100 individuals. This condition, conferring to a research done by Personality Disorder Institute, is more prevalent than schizophrenia, bipolar illness, and autism combined. Good hope that numerous helpful interventions are available. Here is what you can expect on today's episode of Health and Flavor. I'm your host, Bill Hawaka.
I've never heard of such a thing.
Give me 5, 4, 3, 2, and pull it up, pull it up.
There are also those people who say that they cannot sit. This person cannot sit at the driver's seat because if an accident happens, maybe they will be more affected than the other passengers. So that's now the paranoid, the personality disorder.
For example, if you're taking such drinks, they have a lot of caffeine. The soft drinks, some of them have caffeine. If we talk about these cookies, of course, you can see that some of them have chocolates and other, which is not very good when it comes to the management of these conditions, apart from the sugar. So we need to make sure that we cut down some of these foods, especially for the patients who have this condition.
Personality disorder, as a term, may sound negative and judgmental. In African culture, it is usually mistaken to be a complicated disease that can only be acquired in the Western cultures. In other African ideologies, one cannot suffer from this condition unless they are bewitched. We went out to ask what myths are being said about personality disorder. Check this out.
I've been in a forum where we've discussed personality disorder because it's sort of probably a mental thing. It's not a physical thing. You can't look at someone and know they have a personality disorder. But the thing is that people usually think of it as something where umerogwa, like you've been cursed.
According to me, the way I can frame it, I can just say it is just a condition which happens in human being body.
But have you heard of it? Do you know it?
Not really, not really. Yeah.
I've never heard of such a thing. Maybe, oh no.
Intense mood swings, including depression and anxiety, having difficulty relating to people, both in employment and in their family and in intimate relations, are some of the symptomatic concerns. We talked to our medical expert, Dr. Kogi, and here is what he had to say.
Personality disorder is a mental disorder which presents with an unhealthy pattern of thinking, functioning, or even behaving. So it can also be explained as a problem with patients who have that kind of disorder, and they have a problem of perceiving and relating to some situations and also relating with people. Yeah. Well, it's behavioral. And most of the things that you may be able to see from people who have this kind of disorder is that, number one, they may be people who want to learn from reality. Or sometimes people who like to overdo things than they should be done. Or people who like to bring a lot of perfection in things like so excessively than expected. So the causes of personality disorder are not really something that we can say that like it's something that is tangible or something related to the normal things that we know, viruses, bacteria, and all that. So this is something that is related to, number one, genetical factors and also the environmental factors. So we can generally say they are predisposing factors or risk factors. So the medical interventions that are required to handle personality disorder is something that requires a big team to handle it, because this patient is a person who will first of all meet maybe a medical doctor who may be able to find out the presence or a patient exhibiting such kind of symptoms. Then this patient can also will be seen when it comes to the process of treatment. Will be seen also by a psychologist, whereby it's a talk therapy. You know, that's how we refer to it. It's just a talk therapy. Then we also have a psychiatrist. Then we may also have a psychiatrist nurse as well, and also a pharmacist. So it's a big team that usually handles such patients. So when it comes to medication, the medication ranges from mood stabilizers, we have antidepressants, we also have antipsychotics. Yeah. Okay, I think the line depends on the diagnosis that has been made. Okay, usually there is classification for these personality disorders. So the classification depends on the presentation of the patient, because and that's also what makes us also helps us to know the drugs to give, or if a patient just requires a talk therapy and that may be enough, or medication may be required. Yeah. And also I think also it depends also on the length of treatment as well. Yeah. As broad as it is, people need to know that there is those classification that actually should, like if I can mention a few, like there is the the paranoid personality disorder. We also have schizoid personality disorder, whereby people call it, when someone has such a condition, will be told that you have schizophrenia. There is also the compulsive obsessive disorders. So they are classified in like clusters. There is cluster A, B, and C. So in all of those, you'll find that such personalities will actually exhibit different symptoms. Like there's another one called dependence personality disorder, whereby you find a person is not able to make decision on their own. This person has to be assisted. Like someone has to look for so many people to come and advise him or her to be able to make a certain decision. They are not able to develop so much in life because of that dependence. Then the compulsive obsessive disorder is whereby you find a person who is like a perfectionist. Like there's nothing you can do better until they do it, or until they guide you to do it. You know. Yeah, and also we also have something like paranoid personality disorder, whereby you find someone who like feels that you are this person is feeling very insecure. In most cases, like everything that you're doing is offending him. You can just even talk lightly, and then this person just takes it as an insult. Yeah. And then the other thing is that from all that, it's not easy for you to actually be able to relate correctly. But these cases are always picked up when people come to the hospital. You have ever even come across, I don't know if you have ever, but there are those people who will get into a car. They want to go somewhere, maybe in a market, and then they stop the car immediately and say that the car is going to burn, or the car is likely to have an accident. There are also those people who say that they cannot sit. This person cannot sit at the driver's seat, because if an accident happens, maybe they will be more affected than the other passengers. So that's now the paranoid personality disorder. So there are such cases. So they are always picked up when these people come to the hospital. But sometimes you can easily know that someone has a problem. Yeah, so if someone gets such a case, then it's always good to advise them to go and seek help. Yeah, because it's important, since sometimes you may find someone's life, someone who was very good maybe in education, because those are the sectors that usually get problems when someone is in school. They are not able to study very well. Then also when they are at work, they don't get so much productive. If maybe it's a dependence personality disorder, or even the paranoid one, they don't work well. Sometimes you find that they are even in relationships very difficult, because someone will always keep telling you that they keep telling the partner that you are cheating, even when they don't have anything to show that they are cheating. You know, this person is just feeling insecure. Yeah, so that's what I would say in conclusion, since that would help most people to be able to identify these characters. Yeah.
Hello everyone, welcome to Health and Flavor. On this nutrition segment, I'm joined with Mr. Kefa Nyanumba. He's a nutrition expert. Hello, how are you?
Fine, thank you.
Thank you so much for making time to come.
Thank you.
You're most welcome.
Yes.
So then today we're looking at a case study of personality disorder.
Yes.
And so our patient is a 22-year-old by the name Mercy. Mercy is not our patient's real name. So then you can tell us brush a bit about our personality disorder.
Okay, this is actually one of the common disorders that usually affects what you call long-term relationships.
Okay.
And many patients with this condition will actually complain of what you call mood swings, depression, and what you call hypoglycemia, which is a low blood sugar.
All right.
Yes.
Looking at the dietary history of Mercy,
yes,
we see that she likes taking food that contain processed sugar.
Yes,
okay.
And many people actually like most of these foods.
Okay,
and that is why you know I must take a dietary history before we do anything.
All right.
Now these foods are not tasty good, but of
what
course.
Are these foods of processed sugar?
Okay, now examples of course include you know, cakes, donuts.
Those
are some of
like
the examples.
I see,
Yes,
cookies, white bread.
Yes, they taste good, but of course when it comes to the management of this condition, they are not that good because they make the body to spike in terms of blood sugar. And of course when that happens, our body has to produce hormones that actually make our blood sugar to drop drastically, and that of course tends to affect mood swings.
Okay.
Yes.
I see she does not like taking vegetables, but and she also doesn't like taking proteins.
Yeah, you know, one of the challenges many people have is, especially when it comes to proteins, is actually issues to do with the digestion. So if somebody has this condition and they have that digestive issues, they not actually like to take the proteins. But proteins are actually very important because they tend to make our blood sugar stable, and that of course controls our mood.
All right.
And that's very important.
Okay.
Yes.
So then is it specifically that all personality disorder patients do not like vegetables and proteins, or is it just this particular case study?
It's just this particular case study because people actually different. I mean, different patients usually present different symptoms.
All right.
Yes.
Then we see that our patient also likes taking wine on a daily basis.
Of course, for wine, we say avoid because alcohol usually dehydrates the body. And what is very important when it comes to the management of this condition.
Yes.
And in any case, I would prefer that Mercy increases our water intake. Okay. Because water is very important in terms when it comes to our mood, and of course, it also prevents what you call the panic attacks.
All right.
Yes.
There's this advice sometimes I've had before that it's important to take water, a glass of water every morning. The first thing when you wake up, you take a glass of water that has some lemon soaked in it. How good is that?
Okay. Now. It depends. If you want to add lemon once for a while, that is okay.
But does lemon have any? Is it any beneficial?
Of course, lemon has vitamin C, which usually acts as an antioxidant. Okay. And antioxidants are very, very important when it comes to the management of this condition.
All right.
Yeah, but lemon is good.
Okay.
Yes.
So then it's not wrong to add maybe a piece of
you can add a piece of lemon, which is okay. But remember, you can also get vitamin C from other fruits. So the challenge is when people just think that they can get vitamin C just from lemon.
From lemon only.
Yes, and with time they end up taking too much.
Okay.
Yes.
All right.
Yeah.
Then I see that she does not like taking vegetables. So what do you have to say about vegetables? We have some spinach here, I see. some cooked spinach here also.
Yeah, so vegetables are actually very important because first and foremost, they have what you call fiber. Fibers actually assist in terms of digestion.
Yes.
They also contain what you call the antioxidants that are actually very important in terms of the management of this condition. Okay. So it's very, very important that Mercy tries to increase our vegetable intake. Vegetables are very good. Of course, we also need to talk about fruits.
Yes.
Because fruits are also important in the sense that, they also contain some of the antioxidants, like lycopene, that is actually found in the watermelon.
Okay.
It's actually very important.
All right.
Yes.
I see we have a mango here. I wanted to ask, is the skin of the mango beneficial, or is it, can we say it's inedible?
Okay, when we talk about fruits, of course, skin is actually very, very important. But again, when you talk about taking the skin, sometimes you cannot be able to take all the skin. You just need some small amount of the.
Why
is
the skin important?
Yeah. Skin is important because there's some nutrients that are actually contained in the skin, and they might not be in the
flesh of the fruit.
Yes, yes, and that is why, for example, if you're taking an apple, you don't have to get rid of the skin.
Okay.
Yeah, if you're taking an orange, you have to get rid of the skin. So it also depends on what fruits are we talking about.
Okay.
You cannot say that you have to eat skin from all the fruits. For example, you cannot take, you cannot
avocado
take
skin.
You cannot take avocado skin, and you cannot take pineapple skin.
Oh, okay.
Yes.
Okay.
So it depends. It's actually case by case.
Okay.
Yes.
So then, what would be the expected outcome after these dietary changes?
Now, before we talk about the expected outcome,
yes,
it's important for us to also talk about, the caffeine.
Okay.
Yeah, because there are people of these conditions, and they're taking a lot of caffeine. For example, if you're taking such drinks, they have a lot of caffeine. The soft drinks, some of them have caffeine. If we talk about these cookies, of course, you can see that some of them have chocolates and other, which is not very good when it comes to the management of these conditions, apart from the sugar. Yeah. So we need to make sure that we cut down some of these foods, especially for the patients who have this condition.
Speaking about the soft drink, I have a question. Well, there are people who take soft drink with water. They put some water in the soft drink and say they have diluted the excess sugar. Is that any better? But
I would prefer that people stop taking such drinks.
Okay.
Because they don't have any nutrients.
Okay.
They're just full of calories and, of course, chemicals.
Yeah.
Yeah, so I would not recommend that they dilute. We don't need such drinks. They don't give us any nutrients, actually.
Okay.
Yes.
All right.
Yeah.
So then going back to the expected outcome?
Outcome, first and foremost, there's going to be improvement in terms of depression.
Yeah.
That is supposed to improve.
Yeah.
Number two, this patient, yes, socialization is going to be very good.
Okay.
And the patient is also going to be able to form long-term relationship, because that's one of the effects of this condition.
All right.
Yes.
I wanted to ask you many more questions, but unfortunately we're out of time. Thank you so much for joining us on this nutrition segment. Up until next time. Hello everyone, welcome to Health and Flavor. On this fitness segment, we are going to look at exercises that are suitable for patients with personality disorder. Keep in mind though that these exercises are good for everyone. On set we have Mr. Nzuki, who is a fitness expert. He's going to guide us on the kind of exercises that we're going to do today. How are you, Mr. Nzuki?
I'm fine, Bilha.
All right. So
how have you been?
I'm fine. So take us through, what kind of exercises will we be doing today?
And today we'll do exercises which are majorly to release trauma from our bodies.
Yes.
But also we'll also incorporate other exercises which are also good for everyone else. Let's go. Take it out. 1, 2, 3, 4, 5. Now kick and punch. Kick and punch. Left, the opposite arm. The opposite arm with the opposite leg.
Opposite arm with the opposite leg.
Yes, let's go. Yes, there. 2, 3, 4, 5. Now both arms. Continue kicking. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now flex there. Now we need to stretch.
All right.
Now it's time to stretch. Yeah. So lock your fingers together.
Okay.
Push your arms down and face upright. Let's go. Knees straight, make your knees to be straight. That's 5, 4, 3, 2, 1. You feel the stretch here?
Yes.
Oh.
So then for the sake of our viewers, it's important to look forward, to look up.
No, you just face upright.
Upright, all right?
Yeah,
Okay.
that's the most important thing.
All right.
Because it gives the back a good position.
All right.
Yeah. So now we are finished with the stretches. Now we need to take our heart rate, going fast.
Okay.
And the best way to go about it is stretch our arms, and then we start working out from there. Legs together. It's like we are cycling. Yes. Shake faster. We have here a counter of 1 minute.
Okay.
Yeah. Now that's seconds to go. $15 to go. $10 more. Faster. 5, 4, 3, 2. Wow. How are you feeling your hands?
Very tired.
Very tired.
Yes, so then why is it important for someone who has a problem with personality disorder, someone who has anxiety, to do exercises that make the heart rate fast, move fast?
Yeah, we said an aerobics activity, it helps the body to trigger and stimulate anti-anxiety effects.
Okay. All right, so then this kind of process is just among many that can help trigger those anti-anxiety effects. Okay?
Yes.
All right, I understand.
Yes.
Okay. I for sure have found it extremely educative. Now that we know how to relieve stress, we know how to relieve our anxiety through shaking, and not only does it help us to feel calm, but it also releases the anti-stress
anti-anxiety effects.
Anti-anxiety effects on our bodies, which is beneficial not just for patients who have personality disorders, but then for everyone. Everyone from one time to another, you might feel stressful. These are the exercises to do. Self-infliction of pain may be a principal form of communication for people who do not yet have ways to subdue their agonizing inner conflicts and feelings, and who cannot yet turn to others for support. It is important that we show them our understanding, love, and support.
A personality disorder is a type of mental disorder in which one has inflexible and unhealthy pattern of thinking, functioning, and behavior. Hi, I'm Dr. Fasazagai, a general surgeon and a public health specialist. A person with a personality disorder has difficulty perceiving and relating to situations and people. This causes significant problems and limitation in relationships, social activities, work, and school, and can lead to social isolation or alcohol and drug abuse. There are about 8 different types of personality disorders. Along with the professional treatment plan, we have to consider the following lifestyle and behavior change in management of personality disorder. Number 1, learning and getting education about your condition can empower you and motivate you to hold on to your treatment plan. Number 2, physical activity can help manage symptoms such as depression, stress, and anxiety. Activity can also counteract the effect of some psychiatric medication that may cause weight gain. Consider taking up and type of physical activity that you enjoy. Number 3, avoid drugs and alcohol. Alcohol and street drugs can worsen personality disorder symptoms or even react with prescribed medication. Number 4, getting routine medical care, especially if you are not feeling well, is important. You may have new health problem that needs to be addressed, or you may be experiencing side effects of medication. Number 5, be an active participant in your care. This can help your efforts to manage personality disorder. Don't miss therapy sessions, even if you don't feel like going. Think about your goals for treatment and work toward achieving them. Number 6, take your medication as directed. Even if you are feeling well, don't omit your medications. If you stop, symptoms may manifest. You could also experience withdrawal-like symptoms occasioned by stopping medication suddenly. Friends and relatives that have a loved one with a personality disorder should work with a mental health professional to find out how you can effectively offer support and encouragement.
Michael Azema said that a crucial element of the real self is its unconditional acceptance of itself. I have been your host, Bill Hawaka, from here in Nairobi, Kenya. Goodbye.